السلام عليكم ورحمة الله وبركاته. حضراتكم الراوند النهاردة هنتكلم عن clinical and endoscopic examination of the nose and paranasal sinuses. We will start with clinical examination of the nose. We will classify the nasal examination into external nasal examination, internal nasal examination, assessment of the functions. External nasal examination composed of inspection and palpation. When we inspect the nose, external nose, we can expect the shape, size of the external nose using head mirror or headlight. We will comment on the skin, on the swellings, bruising, ulcers, if any scar of previous operation, masses, deformities. We will see in this picture deviation of the nasal bridge. There is a hump in the nasal bridge. This is the example of saddling of the nose. This picture by inspection show some abrasions, bruises, edema and swelling on the nasal bridge. This case of trauma to the nose causing a fracture of the nasal bone. By inspection, this is the right ala of the nose, right side of the nose, external nose. This show ulcer, rounded, well circumscribed ulcer on the ala of the nose. This is a rodent ulcer. By inspection of the nasal cavity, when you look from below, you can assess the columella and the anterior part of the nasal septum. You can assess the nasal vestibule, which lined by skin. In this case, we can see fusiform swelling of the nasal septum on both sides. If this case show history of fever, throbbing pain, we can say this is a case of septal abscess. If there is no fever or throbbing pain, just history of trauma, we can diagnose septal hematoma, nasal septal hematoma. The second part of examination of the external nose is palpation. We will palpate the sinus tender points. This is the maxillary sinus tender point. This is the frontal sinus tender point, and the ethmoid tender points between both eyes, medial to the medial canthus. Examination of the nasal cavity. Examination of the nasal cavity can be done by anterior rhinoscopy. Anterior rhinoscopy means that we will examine the anterior part of the nasal cavity using either pseudicum speculum, this is called pseudicum nasal speculum, or by otoscope, like in the children. We can see any obvious lesion like polyps or masses. We will comment on the mucosa of the nasal cavity if there is edema, hyperemia, or violet mucosa in cases of allergy. We can assess the anterior part of the nasal septum if there is any deviation or bleeding points. We can see the anterior parts of the middle turbinate and the inferior turbinates. We can assess the anterior parts of the middle turbinate and inferior turbinate. So, what is the structure that can be seen by anterior rhinoscopy? Anterior rhinoscopy, we can assess the anterior part of the nasal septum, the anterior part of the middle and the inferior turbinate, the nasal anterior part of the nasal cavity if there is any polyps or masses or discharge. This is the pseudicum nasal speculum. This is called pseudicum nasal speculum, which used in anterior rhinoscopy. We can see the pictures in the right showing right-sided nasal polyp, obscuring all the view of the turbinates. Large nasal polyp filling the cavity. The picture in the left show by anterior rhinoscopy foreign body in the nose, covered by crust. The second item in the examination of the nasal cavity is the posterior rhinoscopy. To examine the posterior part of the nasal cavity, this can be done by the posterior rhinoscopy mirror. This is called the posterior rhinoscopy mirror. Notice the angulation. This is the angulation to facilitate examination of the posterior nasal space. This method can be done by the physician when the patient sitting in front of the physician, by direct headlight or indirect head mirror. The physician in his left hand catches the tongue depressor, and in his right hand catches the posterior rhinoscopy mirror. After spraying local anesthetic material, he asks the patient to take breath and hold. You should prevent the fogging of the mirror by application of warm saline. What is the structure that can be seen by posterior rhinoscopy? By posterior rhinoscopy, we can see the posterior pharyngeal wall, where the adenoid may be present, the posterior part of the nasal septum, Eustachian tube orifices, uvula and soft palate, also the posterior end of the middle, inferior and superior turbinates. The second item of examination of the nose after examination of the nasal structures is examination of the nasal functions, olfaction, airway patency. The picture in the left showing examination of olfaction, each nasal cavity separately using odoriferous material. In the right side, we examine nasal patency by the method of fogging on a metal surface, or we can examine the patency of the nasal airway using a piece of cotton. So, by inspection, what can we see in the right picture? Yes, this is bruising and edema of the eyelids. This may be complication of sinuscopic surgery, or may be complication of sinusitis. Orbital complication in the form of orbital cellulitis. What can we see in the left picture? Yes, this is oropharyngeal examination by inspection. The nasal examination cannot be completed without inspection of the oral cavity. By inspection of the oral cavity, we can see polyp descending from the nasopharynx or from the nasal cavity. This is called antrochoanal polyp, behind the soft palate and uvula. What is the nasal endoscopy? Nasal endoscopy is direct visualization of the nasal cavity by a rigid or flexible endoscopes. What is the principle? It's an optical telescope carried out in the outpatient clinic under surface local anesthesia. It's not an operation. It's not a surgery. It's not an operation. This is a part of the clinical examination carried out in the outpatient clinic under local surface anesthesia. It provides brilliant illumination and perfect visualization of the It allows examination of inaccessible areas which are difficult to examine by clinical examination, as the meatus of the nasal cavity, inferior, superior, middle meatus, also the nasopharynx, stichian tube orifices. Many therapeutic procedures can be carried out in the nasal cavities and sinuses using endoscope. What are the types of endoscopes? We can classify endoscopes into rigid and flexible endoscopes. The rigid endoscope, there is two sizes, 4 millimeter width rigid endoscope and 2.7 millimeter width rigid endoscope. This is used in children. This diagram shows how we use the rigid endoscopic examination of the nose and nasal cavity. This is show sub-classifications of the rigid endoscope. There is some endoscopes with 0-degree length, 30-degree or 70-degree length. Rigid endoscopes comes in the following sizes, 2.7 and 4 millimeter. It comes in various angulations, namely 0, 30, 45 or 70 degrees. The 2.7 millimeter endoscope is used for diagnostic nasal endoscopy and in children. This picture shows how the physician performs rigid endoscopic nasal examination. This is the rigid endoscope fixed with camera and attached to fiber optic cable connected with light source. This camera is connected to video recording system. This is the other type of endoscopes called flexible endoscope. This flexible endoscope can be used for flexible endoscopic nasal examination, also endoscopic examination of the pharynx and larynx, or even the upper GIT, esophagus and stomach. What can we see in these two pictures? The picture above shows rigid endoscopic endonasal examination. Notice there is no camera. The physician can examine directly through the eyepiece, but it's connected to fiber optic cable connected to light source. The picture below shows flexible endoscopic endonasal examination. This is the light source connected to fiber optic cable connected to the camera and flexible fiber optic endoscope. What is the uses of flexible endoscope? It's used for examination of the nasal cavities, nasopharynx, hypopharynx, and larynx. What does this picture show? This picture shows flexible endoscopic endonasal examination. Indications of diagnostic nasal endoscopy: to evaluate why patient is not responding to medication, to determine whether surgical management is necessary in cases of deviated nasal septum or hypertrophied turbinate or presence of nasal polypi, to examine the results of sinus surgery, to determine whether a nasal obstruction, polyp, tumor is present in the nasal cavity, determine whether any foreign bodies like small objects inserted by children are lodged in the nasal cavity, to diagnose reasons for anosmia, to evaluate any discharge from the nasal cavity in cases suspect CSF rhinorrhea, to diagnose reason for facial pain or headache, to diagnose the site of bleeding in recurrent epistaxis. There is no absolute contraindication to nasal endoscope. However, some patients are at increased risk for complication, like patients with bleeding disorder or receiving anticoagulant. Nasal endoscopy should be performed carefully so as not to provoke bleeding. Additionally, in an anxious patient or a patient with cardiovascular disease, there is a risk of vasovagal episode. How can the procedure be done? Topical anesthetic xylocaine and decongestant placed in the inferior and middle meatus and on the nasal septum using cotton pledges dipped in the solution and squeezed for 10 minutes. Diagnostic endoscopy performed using 30-degree nasal endoscopy. If 2.7 millimeter scope is available, it's preferred because it can reach smallest crevices of the nose. 4 millimeter endoscopes is sufficient to examine adult nasal. So, this is a picture showing the view of a rigid endoscopic endonasal examination of the right nasal cavity. This is the nasal septum on the right. This is the nasal septum on the right. The arrow in the left above show the anterior end of the middle turbinate. The arrow in the left below show the anterior end of the inferior. This is endoscopic view of the middle meatus, showing the middle turbinate, and this is called the ansonate process in the middle meatus. Thank you.